everyone, and thank you for joining us for our Monday COVID Emergency Operations Center update. As always, I am Judy Mattingly, the director of the Franklin County Health Department, and with me is our Frankfort Mayor, Lane Wilkerson, our Franklin County Judge Executive, Houston Wells, and our Frankfort and Franklin County Director of our Office of Emergency Management, Tommy Russell. And so, as usual, we'll go ahead and get started today with Mr. Wilkerson, Mayor Wilkerson, and any updates from the city.
Well, thank you, Judy, and good to see you on here this week. And I just want to say that obviously we've had I think 11 straight weeks here in the state with declining numbers, and our positivity rate is down. And I know it is easy to get complacent and let our guard down. But let's remember, like I said last week, that we are still, our numbers in terms of total cases are still where we were when we were most concerned about this virus last spring. And I think that we need to maintain that attitude because it's still not over yet. And I know this week we have many families, we have spring break, and many families may have gone elsewhere for spring break. So we would encourage those to take advantage of the testing when they do return. Health department is testing for free every Wednesday, so it doesn't cost anything. And if I understand, Judy, we still have some spots available for this Wednesday. So, I don't think that we should, we need to take advantage of that is what I'm saying, and get tested if you're feeling like you may have symptoms, or just if you feel like if you've been exposed, or even in the general area of where the positivity rate's high. So let's still be vigilant on this, and because it's not over yet. There are other variants, but I'm happy to say that the numbers are improving, but let's maintain our focus.
And those are excellent reminders, and we certainly appreciate people registering at fchd.org for those testing events, so we know to expect you. And then we'll see what's going on at the county level with Judge Wells.
Thank you, Judy, and thanks, Mayor, for your update. Just a couple things I want to let the public know about. On Saturday, April the 3rd, from 11 to 1 at Lakeview Park, there will be an Easter egg handout as a drive-up event. We want to, more information is coming out about that. It's on our Facebook page, and we want to encourage everybody to, if you're just want to get out with the kids and do a little Easter, something for Easter, it'd be a good event to get out and enjoy the day. It's supposed to be a really nice day on Saturday. Secondly, the county today, as part of state monies, has applied for a grant that is debris pickup and cleanup from the flood. That it's a $25,000 grant. It's for city and county residents, and we'll be working with Tommy and the staff to get that information out. But we don't know all of the guidelines on it yet. But we did apply for it today, and I feel certain we'll get it. But it will be there's certain criteria that you have to meet. But it will be a way to help our residents that have gone through the flooding and the cleanup part, help them out. So we'll get that information out as soon as we can when the state gives us those guidelines. But that will be coming real soon, hopefully within about a week, those monies out there for city and county residents to help clean up. And Mayor, I'm going to piggyback on the spring break. A lot of people are going out. A lot of people end up going to Florida. Florida is one of those states where restaurants are at full capacity. And I will say this, that still be vigilant in what you're doing. Wear your mask. Stores, maybe not restaurants, but stores throughout are still abiding by the principle of wear your mask. Don't come into the store unless you're going to wear your mask. And so wear your mask whenever you can. As always, keep your distance and wash your hands and do the things that you know you need to do. So everybody be safe on that. And I know, and I'm the same way too. It's great to have the freedom. Many of us have gotten our vaccines and And Judy, I'll in a moment, I'll ask you to kind of piggyback on, even if you've had your vaccine, what should you do when you're out and about? Because I've been very proud of this community and the effort and your job, Judy, with your staff on getting the vaccines out. Franklin County is one of the leaders across our great state on getting vaccines, and so we're proud of that. But we don't want to blow it here with this opportunity. So let's be safe. And Judy, with that, I'll pass it on. Let you spread the word.
Well, you are certainly correct about all of that. We have seen in Europe and in even some other states in the United States where once they relax those guidelines, the case numbers start to go back up. And so, yes, we all still need to be watching our symptoms, washing our hands, staying home if we're sick, even if we've gotten our vaccine. And we will get into those details in just a moment. But first, I'll see if Mr. Russell has anything to let our community know about.
Thank you, young lady. Yeah, obviously, the more people that get vaccinated, the more likelihood we are as a city and a county to open up the parks in the city and county to different events that would go on. I know it's been a while since we've entertained and had concerts downtown and the pool open and all those kinds of things. We look at those things very closely, and anything that we do, we'll have a COVID-related plan with it. So whoever the organizer is, regardless of whether it's a city or the county, we will have a plan that goes along with that, and we'll make recommendations as far as the event goes to do the best job that we can do to protect the public. Like you said, a lot of us have been vaccinated now, and I think we're down to everybody that's 40 and above or 50 and above. I can't remember which one, one of the two. So we're moving the right direction, 50 and above. We're moving the right direction. So like I say, I just want to remind everybody that any event, as we start to open up to events again, we'll have a COVID plan with it. So people that are considering wanting to have a race or wanting to have anything at any of the city parks or the county parks, we'll have COVID, not restrictions, but regulations to help protect all those involved. So just as a reminder for everybody out there in the community. Thank you, ma'am.
Those are excellent reminders. And so like we do every Monday, I'll let you all know our current case count is at 3,712 cases, with 24 of those currently being active. And so we love seeing those low numbers, but like you've heard from our mayor and judge and emergency management office, we don't want those numbers to go back up. So we all need to keep doing the right thing still. And so I'm really glad that we're here today talking about this with Easter being this weekend, because I know there may be some confusion about what you need to do if you are fully vaccinated right now. And so the first thing we need to make sure of is that fully vaccinated means that it's been at least 2 weeks since your last dose. So if it was Johnson & Johnson, we know that was only 1 dose, but it still needs to be at least 2 weeks since then to consider yourself fully vaccinated. So if you and everyone that you're gathering with are all fully vaccinated, the CDC is saying that you can gather indoors without having to wear masks. Now, this is indoors in private places, in your home or your backyard. And even if you do choose to do it outside with, the judge reminding us this is supposed to be a nice weekend. And however, in public, everyone still needs to be wearing their mask. We don't know when we're out in public who's vaccinated and who's not. And we don't know who's at high risk when we're out in public, who might be, currently undergoing cancer treatments or suffering from diabetes. And so those are some things that we need to remember there. And then we also find ourselves in that situation where maybe we're fully vaccinated, but maybe our brother or sister or, mother that we're wanting to get together with for Easter is not vaccinated yet. So in that case, the CDC is saying that you as a fully vaccinated individual can get together with members of one other household, only one other household, and not have to wear your mask. And the other caveat there is that everyone in that other household that's not vaccinated needs to be at low risk for COVID and severe illness if you're not going to wear that mask. If anyone in that household, regardless of you being vaccinated, if anyone in that household is at high risk, you still need to be wearing your mask. Now, the CDC is still saying, of course, to keep gatherings as small as possible, that we want to avoid large and medium-sized events and to keep it as small as we can. And then, of course, even if you are vaccinated and not wearing your mask that day because everyone you're gathering with is vaccinated, or you're only with members of one other household that are not vaccinated, you still want to try to maintain your 6-foot distance as much as possible. You still want to wash your hands frequently. And we know now that that can also prevent things like the flu as well. And so that's important to note. And then I do just have to point out that if you're gathering and no one is vaccinated yet with everyone that you're gathering with, then you need to follow all of those same recommendations that we discussed at Thanksgiving and Christmas time with wear your mask, try not to touch all the same, utensils and serving lines and things like that. So were there any other questions that you all can think of that our community might have related to that? And then other than that, I've just got a vaccine update.
Judy, I think everybody wants to hear about the vaccine update and the changes and where it is now.
Definitely. And I think that that's what I'm hearing everywhere now. We just want everyone to get vaccinated.
Yeah.
So as of today, we've given almost 9,500 vaccines. So that is phenomenal, since just the week of Christmas is when we first started getting those Moderna vaccines. And so us in Franklin County, like many other health departments across the state, are going to be transitioning to all Johnson & Johnson vaccine. And it is now available to us in much greater quantities. For instance, we were only ever able to get about 200 doses of Moderna each week. And the great news to share today is we received 1,000 doses of Johnson & Johnson today. And fingers crossed, we're going to hope that we're going to get 1,000 every week now moving forward. And so that is great news for our community. With 1,000 doses coming in to us alone every week, we are going to really be able to nip this in the bud and get everyone vaccinated. However, this week we do need to finish off the Moderna that we still have on hand. And so this week we don't have too many events. We didn't even know we were going to get those 1,000 doses. We had requested them, but didn't know that we were going to get them until they showed up just this morning. And so this week we'll just be having a few smaller events, since we only have limited doses of that Moderna. And then be on the lookout, Franklin County and Frankfort, for next week. There will be lots of links available to get everyone registered. Right now, on our wait list, we are still working on the tier 1C and above. So 1C is going to be anyone 50 and over, anyone with chronic health conditions, and any of our essential workers. And so be on the lookout again next week for those links to register if you fit any of those categories. And at any point that we schedule an event and plan an event and those appointments are not taken, then we will move down in those tiers and open it up to the next tier, which would be anyone over 40. And we hope that we'll be there very soon now with this new shipment, this new influx of Johnson & Johnson vaccine. And, please understand that with the Johnson & Johnson that we're able to vaccinate double just right off the bat, because we don't have to worry about those boost doses. And it is such a great vaccine, 100% effective at preventing death and hospitalization. And that's what really matters. We can all deal with a little cold, if we do have some mild symptoms, but, we can't deal with hospitalization and death, certainly not very well. And so that is the great news that we had today. Did anyone else have anything else to share?
Judy, let me ask a question, basically for the general public. If you get one shot of Moderna or Pfizer, and even though Johnson & Johnson is out there, you still need to get the Moderna or Pfizer. If you're going to get a second dose, you should stay with what you got your first dose with, right?
Yes, you are exactly correct. There is research ongoing right now about the interchangeability of these vaccines. And what I'm reading is that it's looking pretty promising, at least with the Moderna. I haven't actually read a study on the Pfizer yet. But as of now, if your first dose was Moderna, we want your second dose, to be Moderna. And we will, if we gave you your first dose, we will still be getting your boost dose of Moderna.
Judy, another question. What about the state drive-through clinic out on Chamberlain Lane? Are they going to be giving Johnson and Johnson? Or are they still giving Moderna or Pfizer?
As far as I know, they have always offered Moderna. I have not heard about any switch in that location going to all Johnson and Johnson. But Mr. Russell, I'm not sure if you've heard anything different, or I'm hearing him say no also. So unless we hear differently, I believe that the Chamberlain Lane Kroger COVID vaccination site clinic there will remain Moderna. And so that's great for our community. You've got your choices now, depending on which vaccine you like.
Mm-hmm.
So after the J&J shot, Miss Judy, is there a 10-day wait period after that to make sure you've got full efficacy on that, or the 14 days?
Yes, the CDC is still saying to wait 2 weeks after Johnson and Johnson even to consider yourself fully vaccinated. So that's the same with just about any vaccine out there, whether it's a flu shot or a measles, mumps, and rubella shot. Oh, please.
And Judy, do we have any idea how many Franklin County residents have used the regional site that the state's running? I guess I want to know how many residents have been vaccinated. I know how many we've vaccinated, but is there a way to track how many or have gone to Kroger Field? How close are we to herd immunity?
And that's a very good question. And the state is working on that report for us. What the state is currently able to generate very quickly for us is how many people have been vaccinated total at sites in Franklin County. And so the last time I checked on that last week, it was a little bit over 38,000. And so I'm sure it's even more than that now. However, what the state is still not able to distinguish for us just yet, although I know they're working on it, is how many of those 38,000 actually lived in Frankfort, because we know that a lot of people have come to our health department, have gone to the Chamberlain Lane site that might live in Scott County or Lexington. And so the state is working on generating those reports. But even with 38,000, we know that 38,000 people have received their vaccine in Frankfort. So I'm feeling confident that, we're getting there. It's hard to know how many of those live here, but I mean, definitely, if that was 38,000, I'm hoping that at least half of those, maybe 25,000 of them or so, at least half of our population has been vaccinated. But that is speculation at this point until I can see the actual reports.
And it makes me wonder if that's not a wash, because I know I talked to a lot of people that say they've gone outside of our county to get vaccinated also. So maybe those numbers will wash and we'll come out to the 35,000 or something like that, and out of a 50,000 person population, we're doing really well.
Exactly. And, I keep going back to Dr. Stack's statement. It's, one of the things that keeps me going every day is that by July, everyone in the entire state that wants a dose, of course, 18 and over right now, or 16 and over, if you can find the Pfizer vaccine, will have had the opportunity to do so. And, we all know that Kentucky is a little more than 4 million people. And by that time, if you just do the math with how many doses have come into our state, we should really be, at the end of this come July. Fingers crossed. I don't want to jinx us.
Fingers crossed.
And Judy, how do you feel about the people power that you all have to get the number, to get 1,000 vaccines out each week? Do you all have enough staffing to do so?
Oh, yes. Thank goodness for our staff that don't normally work in the area of vaccine administration have stepped up. So that's been phenomenal. And when we run an all-day event with just our 2 lanes, for those of you that have come through our drive-through and know that we just have the 2 bays in our garage, because one, we have to stand in ourselves. We can do 500 a day. And so that's what we're hoping here moving forward is that, and we're meeting with our leadership team tomorrow to pick out what same 2 days every week that will be. And hopefully we are hoping very, very soon we can get to a point to where we can just publicly advertise the links to register, if vaccine becomes available enough where, anyone 18 and over can register as soon as we move through this tier 1C and then down into tier 2, which is anyone 40 or over. But I really feel like with this new influx of vaccine that we're going to go through that very quickly.
Thank you.
No, thank you all.
And you did say that you are doing vaccines this week, but a limited number. Is that correct?
Yes, this week we wanted to finish off those Moderna doses. It's very important for us, to make sure that if somebody got that Moderna dose, that's what they're getting for their second. We don't want to hold events where we have 2 different types of vaccine out to create any kind of confusion for our nurses or our clients. And so next week will be the big push out when we start pushing out this Johnson & Johnson. All right, well, there's no other updates today. And with all of this great news about how we're really going to be just focusing on getting these doses into arms every single week, I do believe we're going to be moving our 1 p.m. Monday updates to every other Monday. And so while we won't see you next Monday, we look forward to seeing you the following.
Very good.
Thank you all.
Thank you.